What are we doing versus what other nations have done, where it seems like you can just
Mm-hmm.
drive up in South Korea and get tested?
Yeah.
Where right now we don't have that capability.
Yeah. So that's a good question. The testing, we could have a test, and we make the assumption that if the test says you are positive for the virus, that you're actually positive. More importantly is if the test says you don't have the virus, that you actually do not have the virus. And these are two separate things in epidemiology. It has to do with the sensitivity of the test and the specificity of the test. So those are two separate things. So from a public health perspective, sometimes we have tests that are good at one thing and not good at the other. The last thing you want is having somebody who think that they don't have the disease, then they go to the emergency room or they go to the doctor, and then they, where there are other people who are sick, not from the coronavirus, but because the first test told them you don't have the disease, and then you go and then you're infecting other people. This is the other part. It's not easy to come up with a test that you know is 100% accurate. And to do it overnight and to do it for millions of people.
Right.
And who is going to administer this test? It means that you might have it in different specific places, maybe the county health department, maybe certain hospitals, maybe certain health providers. And if people have to go there to be tested, then you're going to have people who might or might not have the disease, might or might not be sick. And we're probably going to be talking about the flu shot. Maybe somebody just have the flu, and all of a sudden they're being exposed to a second virus, and then you make things worse.
Do you think that in previous outbreaks like measles, we've had a lot more information about the activities of the patient, and this time it's pretty limited. Should we have more from the state?
So I from a perspective of health communication is how much you share that you can be, you have certainty that what you're saying, you know what you're saying. So you might say something that later is like it was the wrong thing to say, and you might create some level of panic. As it is, we have created a panic where we have shortages of masks, we have shortages of liquids to sanitize, which takes away from people who might be vulnerable and need to have access to these things. So, but at the same time, I think there's a message about not to panic. It's a message about if you're not a high-risk group and you are exposed to the virus and you get sick, the symptoms are somewhat mild.
Is there a tipping point at which you would become more concerned about this epidemic, either here in the state or across the country? Are there certain markers you're looking for that if we cross that, you become a little bit more?
That's a very good question. I had some travel that I looked at it and I said, this is probably not essential travel, so I don't need to go places if I don't need to.
Yeah.
And it's not that I reached that tipping point. I'm trying to minimize my risk if it's not necessary. I think one of the areas where you start becoming really concerned is when you see mortality rate going up. And we saw mortality rate, I think about 6 cases in Washington State. They were somewhat clustered. You could see that these individuals were probably at high risk. We haven't had any major spread in terms of mortality cases in Oregon, so I'm not that concerned. But that's where I would first become really concerned when you start seeing mortality cases going up.
Anything else we should keep in mind as we're, trying not to sow panic and inform people at the same time?
So we shouldn't forget about other parts that from public health that we cannot ignore. One of them is getting your flu shot. Are these two things related? Not directly, but if you, for example, get the flu, and then on top of that, you get the COVID-19 exposure, then you're actually increasing the odds of having a bad case of both of them. So if you don't have your flu shot, just go ahead and get vaccinated, because that takes care of one thing, influenza and the flu, but it also, if you eventually become exposed to the coronavirus, at least you're not going to complicate things to yourself. And like most things, it's not just you, it's just what we know about this virus, it spreads easily. So the last thing you want to do is be infected and then becoming a vector.